Okay. I knew it would be a special kind of torture to be introduced by JP. So the takeaway that I got is I'm a strange and awkward guy who likes to tell people what to do, but I'm really into chiropractic. Special honor to be here and to be able to talk to you. When I was listening to the great speakers yesterday, a couple of times I thought, damn, they're talking about my topic. Until I realized we all have just one topic. We all have the same topic, which is to basically define what it is we do and to protect that. I have a special hobby. I don't do that very often, but at times I go into chiropractic Facebook groups, or I accidentally stumble into them that are not really on our track of thinking, and I sometimes like to infiltrate those groups a little bit with some chiropractic philosophy. On the one hand, because I think it might change a little bit about the understanding, and on the other hand, it's actually a great practice. When you go into groups, like we say, like medipractor groups who have nothing about our philosophy, and you have to really be precise on defining what it is we do and basically debate that. It's kind of interesting. It actually helps me to express it much better. And I have to do it in English too, which is not that easy for me because it's not my first language. And I want to start with one of those incidents. I don't know if you know this guy. Actually, he does something quite interesting. He posts X-ray pictures of different special things going on, and then he asks for a diagnosis. And a lot of people chime in, all chiropractors by name, and they give all those Latin names and complicated things and write huge texts about that. And I like to read that, or I think it's quite interesting. But whenever I read a story like that, I always come from a different perspective when I read it, and I have different thoughts. And in this case, I pointed that out. You don't have to read all of it, but I just started with, I want to offer a little different perspective. And I'm going back to it. I mean, what you can see, I hope you can see it basically clearly. There's something strange going on, like at C4, C5 with that person. It looks kind of strange. I'm not sure what it is. And I told them, well, you know, guys, I'm not an expert in pathology. I'm a chiropractor. So I don't really care too much what condition this person is in. If they have a nervous system, and if they have a spine, if they are alive, and if they're not in a state that requires immediate emergency care, I have something to offer. So with this client, as with every other client, I would just go ahead, I would do my job, help free up the neurospinal system so life force and information can freely travel, and the innate intelligence of the body can do a better job in healing and keeping the system going. Boy, did I create a shitstorm for that. I was told that you see a little bit what this guy wrote, but it was like 50 people chiming in, trying to beat me up that I obviously skipped the classes for contraindications to chiropractic adjustments. I haven't heard that there's a contraindication to adjust somebody, ever. I don't know. I mean, it seems to be quite obvious to me that there are different ways of adjusting people. Because if I can adjust a newborn infant, or was able to adjust my oldest client, she just died recently, she was 106 years old, it's quite obvious that you can adapt the adjustment to different needs. So a contraindication to adjusting? No. So they all chimed in. I won't put that on and won't put those people on and basically putting their underwear over their head. But then somebody chimed in and said, well, but you're an expert for pathology of the spine if you're a chiropractor. I'm thinking, okay, I'm an expert for pathology of the spine. Actually, personally, coming from my philosophy of chiropractic, I don't believe that such a thing as pathology even exists. There is adaptive physiology if the system is not allowed to work as it is intended. And actually every adaptation, even the adaptations that will be deadly in the end, are the best that the system can do in the circumstances that they have. I mean, if somebody puts me out on an iceberg just with my underwear on, my innate intelligence will concentrate the blood flow to my heart, to my lungs, to the most important parts, and slowly my fingers and my toes will start freezing off, which is a very uncomfortable process. But if a ship comes by on time and saves me, I might have lost a couple of fingers and a couple of toes, but I'm still alive, so intelligent adaptation, even though very uncomfortable, and in the end even deadly. There's a point where you can't adapt anymore. So I replied, well, chiropractic is solely about increasing health. Actually, I should have wrote life. I learned when I wrote. And allowing the innate intelligence of the body to work as good as possible by assisting and clearing interference to expression of life force. And since the spine is the instrument we work this, there's this beautiful picture of BJ, I have it in my office, where he has the spine on like those metal things and he's exercising and it looks like somebody playing an instrument. And that's actually what we do. So we play the spine like an instrument to get into the system and to assist the system in clearing interference. And since we play the instrument, spinal issues more often than not go away. Disc problems go away, headaches go away, all things go away. And since we increase the healing capacity of the body by clearing interference, people heal from all kinds of things, but that's side effects. It's nothing but side effects. It's not what we do. So I'm not an expert in pathology. And I already talked about that. I have not seen a single person in the world that couldn't be adjusted, no matter the condition. I remember this one guy that I had years ago. He had Bechterev's disease in a very, very proceeded version. So his whole spine, basically up to C2, was like a bamboo rod. There was nothing moving at all. And if you come from a mindset of being like a bone doctor or a spine doctor, you would say, what would I do with a guy like that? I mean, Atlas was still moving, but with him, I adjusted everything that I found with a basically adapted approach, but I would not just adjust C1 and C2. I also adjusted the segments that were fused, that were bamboo. And the change for him, I think he was like in his 40s. When he came, I luckily had a high-low table because I wouldn't have gotten him on a normal table because he was in so much pain and could hardly move. And after like 2 months of care, he was playing golf tournaments. Of course, he had to adapt to swing because he wasn't moving quite right, but he actually won those tournaments in a pretty high class. And was I moving bones around in his spine? Surely not. It was bamboo. But there was still a nervous system, there was still a spine, and adjusting even this bamboo rod actually helped the innate intelligence to perceive the body and the nervous system to function better, and he functioned better. So there's not a single person that couldn't be adjusted. I mean, the only exception is if blood is spilling out, something else needs to be done first. So the interesting thing is, nobody basically chimed in on my side, and I got beaten up pretty badly and found it quite entertaining. As JP said, I'm an awkward guy. But I noticed right afterwards, just like minutes later, I received friend requests after friend requests from chiropractors. It was like 20 friend requests in like 2 minutes. I was thinking, oh, somebody watched this discussion. And then I got like 2 really nice messages. One from a chiropractor from Iowa who wrote, he sometimes reads things on Facebook, but he never engages in discussions, and he never wrote a message like that, but he just wanted to let me know if I'm ever in Iowa, he wants to buy me a beer and a steak. Thanks for what I'm doing. And then there was this other DC lady from New Zealand who wrote me a very nice message, and we wrote back and forth about philosophy for like 3 hours after that. And that's really nice. So sometimes you do make an impact even if you're not aware of it right away. And short time afterwards, he posted this thing. Obviously, which I learned from, it looked strange to me, but I didn't really think about diagnosis a lot, but a lot of people chimed in and gave all kind of Latin names. And obviously it's marble bone disease, osteopetrosis. And they used that for, he wrote that this patient coming in just wanted a quick adjustment, and the good doctor took x-rays and then found out that she has osteopetrosis. And so far, so good. But then I was thinking, well, what happened afterwards? And when I read what those chiropractors wrote in the text, the most wrote, yeah, I've seen things on x-ray like that, and I'm so glad I took the x-rays and then referred the people out. And I'm thinking, well, if the fact that he took the care to wait for the x-rays and found out that there's something strange going on with her, she also got a spondylo at L5. If that led him to choose a different, a more customized adjusting approach for this lady, then it's indeed a happy story. But if it led to him saying, oh my God, she's got osteopetrosis, I want nothing to do with it, refer her out, then it's a sad story. And I would actually bet that there's a 90% chance it was a sad story in this confused world today. And the biggest problem, and many speakers talked about that, is that most chiropractors these days have no idea what their job description actually is, and that they have a hard time defining something that can actually pretty easily be defined. And that's a thing that is actually very common in our confused days right now. Words and definitions matter a lot, because we use speech not just to communicate, but we use speech to find common truth. And if there's no real definitions of the words that we are using, we have chaos. It's basically the thing which has been very popular in the last years, that people say, well, if you claim to be a woman, you're a woman. And when you ask them, well, what is a woman? They can't define a woman. And it goes around and goes around and goes around, and nobody knows what we're talking about. It's like if I walk up to Travis and say, well, Travis, I define as a gobbledygook. And Travis might say, well, Kai, that's great, I'm happy for you, but what in the world is a gobbledygook? And in the moment when I can't define what I'm talking about, communication breaks, which is a very, very dangerous thing for society. So we have to be clear in our definitions. And when it comes to chiropractic, I think an approach which is very popular in old Indian philosophy is very interesting to more easily define it, and that's an approach to find what something is by negating what it is not. They use that in all kind of different ways. They call it the neti approach, which basically means I am not this, I am not that. So they use that for finding their own identity and many different things, because sometimes it's much easier to make it very clear what something is not, and that actually leads you to what it is. Krishnamurti, the great Indian saint, well, he would say he wasn't a saint, but the great Indian saint said, if you strongly reject the road that you don't want to walk on, you're automatically, in most cases, on the road that you want to walk on. So I want to go straight back to the horse's mouth for that, to the fountainhead. And to me, Didi is still the person who had the most profound and deepest understanding about what it is we do. And as the founder, he has the right to define it. This is very interesting text, because this is his very first newsletter that he put out in 1908. And it was just rediscovered in the Parma archives, and Simon Sensen, one of the smartest people in our profession. Whenever I have like a moment where I think I'm smart, I read something by Simon Sensen and I'm down to earth again, which is very good. I use Simon to humble me. His TIC Institute, if you're not a member, if you're not heard of it, I highly recommend it. If you want to learn about philosophy, history, there's so much resource there. And he just rediscovered that in the Parma archives and wrote about it. And what's interesting, I should have highlighted it, but Didi says, it will explain chiropractic, tell what it is and what it is not. And The name is the chiropractor adjuster, not by accident, and not everybody knows that. It's not about this is the adjuster, but the title is meant to adjust the mind of other chiropractors. Because Didi in a very short time noticed that some of his students, in his mind, including BJ, were misrepresenting a lot of his chiropractic, and he wanted to adjust their thinking. So that's what those newsletters were all about. What does he write? Therapeutics is concerned in discovering and applying remedies for diseases. Chiropractors do not treat diseases, they adjust causes. They do not use remedies of any school to treat effects. Chiropractors are not concerned about remedies. What is a remedy? A remedy can be a drug, a remedy can be an acupuncture needle, a remedy can be a lotion, but a remedy could also be a trigger point. And a remedy can be a manipulation to the spine if you do it to relieve back pain. Then it's a remedy. So it's not just a thing that you put in that like a chemical substance. A manipulation can also be a remedy. And he goes on to say, and he's so crystal clear, a chiropractor is not a therapeutist, as he is not interested in disconveying nor applying remedies. To be versed in therapeutics would be one who is skilled in the use and application of remedies. Chiropractors do not use remedies. Chiropractic principles are antipodal to therapeutics. They are not related to or pertain to therapeutics. Chiropractors are not therapeutists. The chiropractic science is not therapeutical. A chiropractor repairs by adjusting, fixing, replacing. He does not use any therapeutical remedies. Chiropractic is non-therapeutical. There it is, straight from the fountainhead, straight from the beginning on. And even a lot of principal chiropractors, I just had the discussion with a friend of mine, don't know that. He told me, well, yeah, and non-therapeutic chiropractic started with Reggie Gold. I said, no way. Reggie was a great influence, but this is what we were from the beginning on, and Reggie basically tried to remind people of that because somehow we forgot. The chiropractic is non-therapeutical. Chiropractors do not treat, cure, heal, or diagnose diseases. It is crystal clear from basically day one. I mean, 1908 is not day one, but pretty close. And also important, they do not wait for special symptoms to develop in order that they may determine the disease so that they may decide on the proper treatment. So that absolutely clear, a person does not need to have any condition, any pain, anything to be a candidate, to be checked, and if there's subluxation, adjusted. Then he goes on to tell some interesting things about innate, and I don't want to read all of it, but what I find very interesting is the part that is in green. And he's asking, when we as chiropractors have adjusted all displaced bones, as he calls it, what more can we do? And he's using the example, he said, we might as well try to inform the tree how to run the functions of its roots, bark, and leaves, and sap. And the tree could well reply, I know better how to run the functions of my existence than you. Make my environment suitable and I will look after my vital economy. So it is not up to us to decide what happens afterwards. The whole job, it's so crystal clear, is to analyze as good as we can, adjust with as much expertise and excellence that we possibly can, and then the job is done. It's easy. And everything that happens afterwards is not up to us, and it's not our credit. So this is a very important point, and it's a slippery slope for many chiropractors. He uses some other examples too from Christian Science, that the innate intelligence could tell the educated, mind your own business, let the all-wise goodness care for that which it knows vastly more of. And when we look, a lot of chiropractors like to compare chiropractic to dentistry, which I don't think is an ideal example, but if we look at the history of orthodontics, putting braces on teeth, the whole modern orthodontics is actually based on one paper from the 1950s, and I think it was even a German dentist. Have to dig it up, but it was around the 1950s, and he defined the perfect bite for people. quite entertainingly at that very time where he defined that 90% of the population didn't have this perfect bite, which made everybody customer. But looking at chiropraktic, there's a pretty large movement of chiropractors who also communicate quite vitalistically, who say the job of a chiropractor is to create ideal curves in the spine of people. And they even compare themselves to orthodontics. And they say, well, there's an ideal spine for a human being that has been scientifically defined, and our job is to make the curves of the people fit this ideal pattern. How does that fit the philosophy we're based on? Shouldn't innate be the one to decide what the perfect curves for this person at this given moment in time should be? And actually I heard of many people who leave care, long intensive care with colleagues like that, having a perfect looking spine and feeling miserable. I mean, it's not about feeling, but it tells you something. So this cannot be chiropractic. Chiropractic is not orthodontics, and it's not our job to define this is the spine the person should have, and we're going to force the curves into that pattern. This cannot be chiropractic. It's something else. Can it be valuable? Absolutely. There's so many valuable things, but it's not chiropractic. The same thing is like with a movement that has come very popular in the last years, like brain-based and neurology-based chiropractic. And I've dived into that movement a lot because there's a lot of interesting things in there. By measuring how brain waves change when we give chiropractic adjustments, see how the neuroplasticity of the brain changes. That is so interesting. And if you just use it for that, if you just do your normal protocols and adjust the subluxations you find and then look into the brain and see all those changes, that's awesome. But again, it's a slippery slope. But many of those colleagues then become very scientific and become functional neurologists and start doing neurofeedback and all kinds of things and adding all kinds of things to actually change the brain waves of the patient to a pattern that they think is best for that person. I think I'm not smart enough to know what the brainwave pattern for that person should be. So if I'm measuring those patterns and I see that they return to a more functional, more adaptive pattern when I adjust them as I always adjust them, then it's a great proof what chiropractic can do deep in the nervous system of people. But if I decide that alpha waves should be at 30 something, and then I'm trying to do all kinds of things and giving them exercises and this and that and other neurological tricks to change that, then this is great stuff. But it is definitely not chiropractic. So please, if you want to do that, just don't label it as chiropractic. You're doing something else. I haven't seen anything in the 33 principles that is about treating disease or applying remedies or anything. There's actually, which is really interesting, nothing in about the adjustment at all. It's just about life. But when we see those basics laid out by Didi and the 33 principles, it's all the same thing. So basically, if we look at those basics, it's pretty much, there's a story that Michelangelo was asked how he makes those great sculptures. And I don't know if the story is real, but supposedly he answered that, well, if he wants to make a horse out of marble, he looks at the block of marble and basically chips away everything that doesn't look like a horse. And we have to try that. So when looking at chiropractic, I sometimes find it easier to just stick to these definitions and then look at different things and say, oh, well, that's interesting, but that's not what it is. And if you keep repeating that, and you find, okay, that's cool, that's nice, because people have very good arguments. I got into another friendly discussion with a guy on Facebook who claimed, well, many chiropractors doing high volume, they don't look at this and they don't look at that, and people need more than just an adjustment. And that's why I do meridian therapy and this and that, and my people are very happy with it, and I'm very successful with it. And I'm saying, well, that's nice, and those kind of therapies are probably great, but the thing is, it's not chiropractic. So please don't label us at that. I mean, it's absolutely obvious that people will need more than chiropractic care at times. If somebody has an infected root canal, which is poisoning his body, which will be causing subluxation and all different kinds of things, you need a great dentist to find that root canal and remove it. Of course they need something else. But the logic that some people in the profession have would say, oh well, since people sometimes have infected root canals and that's detrimental to their health and that's causing subluxation, I need to take a course in dentistry and find out how to remove root canals so I can best help my clients. No, there's great dentists out there. Have a network. Refer people out, yes, but also adjust them. So if clients come to me and say, well, you know, everything's great, but I think I need a detox for this or that reason because I had this or I had borreliosis and so on. I say, well, I know some great holistic MDs who might want to take care of that. And then I proceed to explain them again how important it is that their inner God has the chance to guide everything perfectly and that they're without interference. And then if they want to do a detox because there's something going on, there's people for that. And my job is to adjust the neurospinal system so the inner God can do its job. And this is one, maybe for the younger people, from my own experience, I would like to share that with you. For most of my career, I was talking more nervous system based, like most people do, because it sounds more scientific, it sounds more doctor-like to talk a lot about the nervous system. And of course, people get it, but people really get it if there's something profoundly different and also touching. It's even if you, there's studies in marketing, if you want to convince people, there's two things that are actually the key to it. One is novelty, and the other one is authority. So if people come into your office and everything is different from what they're usually used to. I mean, look at what an MD's office looks like, what the energy is, and then go into a great principled vitalistic office, which is vibrant, which is life, and people coming in happy and laughing, and because they're doing something for themselves, and kids are playing, crawling around. It's a totally different atmosphere. If you have only experienced the medical system and you walk into a clinic, if you walk into an office like that, yeah, you have to watch your words. It's important. There's novelty. Then we do different assessments that they have never experienced before. There's novelty. They are in a totally different situation, which is important because it opens them up. And the other thing is authority. And authority has much to do with certainty. You can create authority with white lab coats and stuff hanging around for some people, but if you're really certain and really clear in what it is that you're doing, that creates a positive form of authority and report. And I found when I started changing my communication a little bit more away from the nervous system, I still talk about it, but more about how amazing this innate intelligence, and I like to call it the little inner God. And I find even though most people in Germany are not very Christian and so on, that the way I explain it with the little inner God resonates to people. And I feel comfortable with that word, so I use it. If you don't feel comfortable, use something else. But explaining to them that this force, this intelligence is there from the beginning on, when the first two cells come together and does everything for them. It's so obvious. Nobody thinks about that the immune system is working. You don't have to control your immune system. You don't have to tell your heart to beat. You don't have to tell your fingernails to grow. Isn't that amazing? And in a woman's body, in less than 10 months, it's a full new human, and she doesn't have to think about what to build and how to do it. So this amazing intelligence keeps 30 trillion, you have to say in American, billion it would be in German, 30 trillion cells in harmony every day. And that is so amazing. And I would advise, if it feels comfortable for you, to make this the main point. Because my observation is, All the other stuff about the nervous system and the interference is very logical and people get it. But the other part about the innate intelligence, about the little God inside that always knows best, that never makes mistakes, and that sends out information and energy that is absolutely perfect at any given moment. It just can be interfered with on its way to every tissue cell. That they have this power inside. This empowers people. That's different than understanding, okay, I have a nervous system, there can be interference, okay, it makes me healthy if I don't have it. But realizing the amazingness of the human existence, the amazingness of this vehicle that we are giving for this awesome experience as a human being, that we can be inside this vehicle and use it, and that we have this intelligence that does everything for us. We can be so lazy and play around. This gives people so much power back, and the whole system is taking power away. And we are the only ones, basically, even in the whole field of more holistic people, to give them their power back. And that's profound. So I would advise, talk to them about that. To me, that's the most important aspect. And another thing that's important, whenever people combine anything with chiropractic, and even if it's great stuff, the most difficult thing that we face, I think you can all agree with that, when you really communicate chiropractic, is that it is so different from anything else, and they very, very quickly confuse it with something they know. Human beings are wired like that. We hear something new, but we think, okay, that's a little bit like, and then we miss that we learned something new. Oh, that's a little bit like osteopathy. Yeah, they use their hands and they're very holistic. And okay, that's something like that. No, it ain't. And we are the only profession on earth that is absolutely non-therapeutic. Everything out there in the holistic field, osteopathy, homeopathy, acupuncture, it's all a treatment paradigm. So it's basically all in the paradigm of medicine, even if it's more holistic. We are the only ones that are non-therapeutic. I don't care what people walk in. I don't care if they have a headache, backache, or if they have AIDS, or Parkinson's, or multiple sclerosis. I don't care. All I care about is that they are alive, they have a nervous system. I'll check them, and if I find something, I adjust it, and my job is done. And I know they're always better off being adjusted, because if there's interference to your neurospinal system, the capacity of healing is lowered and the expression of life force is lowered, and that's not a good state to be in. It's as simple as that. And of course, you need to pick people up where they're at. And of course, you can tell them that they have a huge chance that their headache will go away, because that's usually what's happening. But you have to explain them what it is you're doing and what you're not doing. And so chiropractors know how to do that. The most important part is chiropractic education. And there was a great essay some time ago, I think he wrote it like 15 or 20 years ago, by Christopher Kent. He had those chiropractic thoughts, short essays that he wrote about how chiropractic education needs to change. And the thing is, people are so confused because their education is confusing. And basically, because the American Medical Association didn't succeed with bringing chiropractic down with conspiracy, and because they lost in court, they had to do it differently, so they infiltrated education. That's basically what happened. Because every bad system and every totalitarian system goes to the young. Then you don't have to change anything. You don't have to fight the old guys, because they will die off. So education is important. And the thing is, first of all, I strongly believe that chiropractic education should never be a business. Of course, it should not be a minus game, and it should pay the people off that work in it, but it should never be a business, and it has to be affordable. And that's what Christopher Kent wrote, chiropractic education needs to be affordable and accessible. And one most important thing is we have to get the best people in to teach, and that's the biggest problem. I mean, look at people like David or Andreas, myself, Marco, we're all in busy practices every day, working on people. Nobody of us would take a staff position in a chiropractic university because we don't have time. We need to adjust all these people. But everybody of us could take like 3 days off, go to university and teach a module. So this is how education needs to be taken on. And that's actually what we're doing in Germany. And Christopher Kent wrote, those are things we could do. Distance learning. Reducing both costs and time required. Why do people have to sit on a huge campus with buildings and with heating and with all those huge expenses. I mean, a lot of chiropractic education, a lot of the basics in physiology, neurology, all that stuff can be done at home. And then people can write tests about it and people can chat about it. And if you have online learning, I mean, there could be like a David teaching philosophy, and it could run in 5, 6 different chiropractic colleges, and everybody could be watching it, or Simon doing it, or Andreas doing it. Why does it have to be in person? The only part that needs to be in person is the hand-on adjusting skills and maybe some of the philosophy, because sometimes you need to feel the energy of a person to really get inspired. But a large part can actually be done online, and then you don't need a real big campus. I mean, look at our university campus in Hamburg. It's a beautiful, large room that has room for all the students and room for all the tables. It's one large room. That's it. It's not a huge university with 10 buildings. Who needs that stuff? And for the degree, it's a collaboration with an existing university that has no say in how we teach chiropractic, and they don't want to have a say in that. They're just providing the basically educational framework that is necessary in Europe, so you get a degree. And since that degree then is valid all over Europe, because we have laws that are for all Europe. If you have a bachelor's degree or master's degree, it's recognized all over Europe. Then you don't need the ECC. I mean, that's a classical Gandhi philosophy thing. You don't collaborate with harmful forces. You don't. I mean, of course you can talk. We should always be in debate. But if you get accredited by those people that are trying to destroy the profession, or to make it a little easier to turn it into something it is not. If you're accredited by them, that's actually not a good thing. And if they don't accredit you, that's actually an honor. So work yourself around. Regional learning centers, or working with a professional that is already in practice. That's actually what we're doing with the bachelor program. We have seasoned chiropractors that send young people in to take their bachelor's program, and they're also working in their offices. So they have a mentor from the beginning on. That changes everything. And it's so easy. Why is not everybody doing that? Online courses, training practices. Chiropractic education should be joyful, fulfilling, and a nurturing process. Yes, 100%. And it's very, very easy to do it. And actually there, Europe is a chance, because the things are basically invented out of nothing. And so we have a chance not to repeat the mistakes others are making. But if the US is not turning around, if they want to keep the, I mean, of course, if you have a beautiful university, you want to keep that. But sometimes you have to tear things down to make it better. And if it is about chiropractic, it's ridiculous that a degree costs 200,000, that's the cheapest, I think, to 400,000. In Germany, it's a tenth of that. And everybody can afford like 30 to 40,000 euros to get a degree, because, I mean, you will have that money back in your first year of practice. That's easy. And if you actually have trained under a mentor from the beginning on and have learned from the best people in the field, because they just come in for modules. I mean, imagine, we had Arnaud Bonnier teaching at our program as a professor. We had Steve Hoffman teaching at our program. We had, for the Gonstead people, we had Ian Rosborough from Australia teaching at our program. You can get the best people in for 3 to 4 days. Everybody will give back to the profession and do that, but you can't hire them as staff. That's ridiculous. It will be bad for the people. So that's the other thing, I think, where we have to get very active, and I can't be active in America, but maybe somebody else can, to change the profession. And we're doing it here in Europe. And the more successful it gets, maybe people in America will learn something from it, and then we can make it crystal clear from the beginning on to every student what chiropractic is not, and get them on the right path. Because, as Shakespeare said, a rose is a rose is a rose. And chiropractic is chiropractic. And if you don't like it, call it something else. But don't mislabel it. Thank you.